In recent years, the number of cancer cases in the country has been rising steadily, placing a growing burden on families, especially those from economically weaker sections. In this context, could the Minister state that what concrete steps the government is taking to ensure timely availability and affordability of essential cancer medicines for poor patients, and how access to treatment is being expanded through public hospitals and support schemes? And further, sir, cancer vaccine has come. That's what we heard through the newspapers. What is the news about it? That I would like to know through you.
Honourable Minister.
No, I'm glad that the Honourable Member has asked a question which I'm sure she could actually ponder over after going through the subject deeply. It is true that the cancer incidence actually has increased all over the world. If you take the world statistics, we have 20 million, that is around 2 crore cancer patients happening every year. If you take India alone, it is about 1.4 to 1.5 million, which is almost 15 lakh. And the figure is expected to go up to almost 2 million by, say, 2040 or so, which means it will be nearly 20 lakhs. So we stand number 3 after China and USA as far as the prevalence of cancer is concerned. This could be possible, could have been possible for a number of reasons. A, the changing spectrum of disease in this country today. We have, earlier on, the medical professionals would bear me out till 1980s. We were mostly beset with the communicable diseases. Then the era came of non-communicable disease after 1980-85. You started having coronary heart disease, you started having metabolic disorders, even the cancers, and somebody in a lighter vein wrote in our journal called the Journal of Association of Physicians of India that now India has entered into an era of civilized diseases. We don't die of tuberculosis, we die of a heart attack. Well, that was in a lighter way. But what I was trying to say is the spectrum change. But as of today now, what has happened is that we are beset with both. We have communicable disease also and non-communicable. With the increasing lifespan, on the one hand, we have those cancers which were not happening because people were not living long enough. At the time of independence, for example, the lifespan was hardly 50 years age. Now it's going up to almost 70. At the same time, the environmental factors, the extraneous factors, whether it be in the atmosphere, in our food habits and food elements, all these have further contributed. And the irony is that many of these diseases, including the cancers, which were earlier happening in the later decades of the life, have started happening in the earlier decades. So cancer of a later age, about 2 decades back, now can happen at an earlier age. Heart attack, or a diabetes mellitus type 2, which was happening at the age of 50, is now happening at the age of 30, 25. So there is a biphasic spectrum of disease and also biphasic lifespan, in the sense that though we take pride in saying that India comprises 70% of the population below the age of 40, but the other half of the truth is that the actual number of plus 60 citizens has also gone up. So it's not that if 70% are below 40, the oldies are quitting. So it's a biphasic. So that also adds to the disease spectrum and the disease burden. And as far as treatment is concerned, as I mentioned, government has started an ambitious program to provide a cancer facility in virtually every district hospital in the country. This is a heterogeneous country. The nature of cancers also varies. For example, in Northeast, you have head and neck cancers. About vaccine, ma'am has asked, and she's right. The other department which I am dealing with, the Department of Biotechnology, has come out with the first ever HPV vaccine, which is said to have a preventive role in the prevention of cervical cancers, which are said to be very common, more prevalent among the young females in India. And we are negotiating with the Health Ministry how best to make it available to a larger population at an affordable price or free of cost.